Thank you very much, Tony. It's great to see everybody. And it's my pleasure to introduce today's speakers. So just so you know, we're fortunate enough to have an annual Shriver Grand Rounds as part of the department's Grand Rounds series. And I thought I would just pause for a moment to let people know a little bit about the Shriver Center, and then I'll introduce our guest speakers. So for those of you who don't know, the Shriver Center is an independent center of excellence. We were founded in 1970, and we are truly interdisciplinary in that we have faculty from pediatrics, family medicine, and psychiatry, with a total of 25 faculty, 44 staff, 25 affiliated faculty, and 7 adjunct faculty. Our mission is to transform systems, policy, and practice by engaging in innovative research, education, training, and service so that people with intellectual, developmental disabilities, and behavioral health conditions may lead self-determining lives. I'm going to share a quote with you from Eunice Kennedy Shriver, because this sort of epitomizes who we are. And we try to select speakers every year that reflect our mission and also reflect what Eunice Kennedy Shriver said. So she said, if you don't have an idea that materializes and changes a person's life, then what have you got? You have talk, research, telephone calls, and meetings, but you don't have a change in the community. So with that, I am honored to introduce our speakers for today's Grand Rounds. I think they epitomize our mission, and they epitomize the quotation I just shared with you from Eunice. And I selected both Amy and Terri to present today because we have found that a lot of people within our UMass CHAM community are not aware of their good work. So I thought having them speak today would be a good opportunity to showcase what they do. So let me start by introducing Amy Weinstock. Amy is the director of the Insurance Resource Center for Autism and Behavioral Health at UMass Chan Medical School's Eunice Kennedy Shriver Center. She's an instructor in the Department of Psychiatry. She has an extensive background on insurance issues related to both autism and behavioral health. And she's played a key role in passing several significant pieces of autism insurance legislation in the state of Massachusetts, including the groundbreaking 2010 law, which requires health insurance to cover medically necessary treatment for autism, and I would add across the lifespan. It's probably the most comprehensive autism insurance law in the country and serves as a model for other states. Amy also serves as a trustee at the Riverview School, Living Independently Forever program, and as a commissioner on the state's Autism Commission. Following a successful career in real estate and banking, Amy, who is a parent of a young adult on the autism spectrum, decided to merge her personal passions and professional experience. Amy is a graduate of Wellesley College and received a Master's of Architecture from Harvard University and completed the Lend Fellowship at the Eunice Kennedy Shriver Center in 2005. And the Lend Fellowship is a leadership education in neurodevelopmental and related disabilities fellowship that we offer annually. Her work has been recognized through numerous awards at the state and national levels. And she's joined today by Terri Farrell. And Terri is the Senior Project Director of the Insurance Resource Center for Autism and Behavioral Health. She came to this work through her son, who was diagnosed with autism at the age of 3. And she's been at the Shriver Center for 10 years. In 2017, Terri joined the Massachusetts Behavioral Health Partnership Family Advocacy Council. And also in April 2017, she was appointed to the Massachusetts State Autism Commission 22 Plus Employment Subcommittee. She was the Government Affairs Chair at the Autism Advocacy event for AFAM, and AFAM stands for Advocates for Autism of Massachusetts, for 10 years, from 2013 to 2023. And in 2023, Terri was named the faculty for Harvard Medical School's online education course entitled Clinical Care for Autistic Adults. And with that, I'd like to turn the podium over to both Amy and Terri so that they can share more information about their good work.
Yep, my microphone's on. You can hear me. Thank you. Thank you, Jean. And I love that quote from Eunice Kennedy Shriver. And as Jean mentioned, I'm the parent of a young adult with autism, and she would tell you all my mom does is talk on the phone. So maybe we haven't come that far, but I'm going to talk today, and Terry's going to join me about our work, insurance, advocacy, and beyond. So as we said, if you have questions, we'd love to take them, maybe type them into the chat in the Zoom, but we're not so familiar with this format, so I may not be seeing it as much as when I'm using my little box. So we've got a few hours of material here to go through, but I'm going to give you the context in which we came to this work, a little bit of background of how we got to ORECA, which was the insurance law that Jean referred to, which led to the creation of the Insurance Resource Center, and then talk about our work that we currently do, and then a little bit just about how insurance works, because it is so confusing still for everybody. So this is a quote from, not the "it takes a village to raise a whole child," that's an African proverb, but Peter Gerhardt, who's a psychologist and behaviorist and works with people with autism, does wonderful work. And so he's said, it takes a whole village to raise a child, but to raise a child with autism, to be an employed, included, safe and productive adult takes something like a village, 2 small towns, a mid-sized city, a chapter of the Hells Angels, 6 communes, a large trailer park, an on-call medical team, and a fleet of vehicles. And I will tell you, as a parent, I think this is actually true. But I'd like to say in my day job here at the Insurance Resource Center, well, no, because we're part of the medical, before my day job, in the work that Terri and I did on autism insurance, we kind of think of ourselves as that chapter of the Hells Angels, because what we really did was change a system that was not working, and when we continue to address a lot of those challenges. So this is the background of how we came to this. Our children, who are now young adults, were diagnosed with autism, and we both had careers in business and banking and whatever, and we're doing pretty well in those, but this just brings you to your knees. And in the early 2000s, I was just flabbergasted that my child had a neurological disorder, and thank goodness it was the early 2000s, because by then at least the research had come so far that they knew it was not caused by bad mothers who didn't know how to love their children, which was the prevailing wisdom a generation or two before that. But we were sent to our school to get services, and we were both intelligent people, and we were reading up on things, and we knew there was research to show there was efficacious treatment, but to access it was beyond impossible. And so this cartoon of a patient sitting in a doctor's office, unfortunately you have what we call no insurance, wasn't really funny. That's what was really going on. And so, and then this quote from the New York Times was also really true. So I decided in 2004, my daughter was about 4 or 5, that I was going to leave the workforce and pursue that work-life balance. If anybody's thinking of that, let me just tell you, it's a myth. But at the time, I said, well, as long as I'm going to be doing that and having more time, I'm going to see if I can actually maybe use my background in banking, which was the regulatory risk management, to apply it to this problem of no insurance coverage for autism. So I found the Lend Fellowship program at Shriver. I think I was a little bit of a square peg round hole because I really wasn't coming from a background in neurodevelopmental disabilities, except I was living it. And I did a fellowship and I did a research paper, our capstone, and it was called Expanding Insurance Coverage of Applied Behavior Analysis Treatment for Children with Autism. And I had 3 recommendations: corporate advocacy, litigation, expanding Medicaid, early intervention. And I can tell you almost 20 years later that it's all sort of happened. I didn't actually have legislation in there. That ended up happening first. I did have it in the paper, but I had it as a footnote that that would be the best way to address this, but probably impractical for time and whatever. However, we had this legislation passed, and you're going to hear a little bit about it. When they do the movie version of how this happened, they will find someone much prettier and more glamorous to play me, but they're going to say, oh, she went to UMass, she did a Lend Fellowship, she wrote a paper, she took the subway to Park Street, went to the State House, got a law passed. So the paper was a blueprint for the law that was passed, but if anybody's worked on legislation, things don't really happen that way. It took a lot, and we don't have a ton of time to talk about it, but you'll see a little bit. But from 2006 to 2010, these advocacy efforts started. Terri was quickly attached at my hip there and doing what you need to do to get a law passed. I lived in that T-shirt for more than I care to remember. And we did this with no budget. It was just grassroots volunteers. We had a great group of people with a lot of skills, and that's what it takes. But the investment in this was, we had about 10 of those T-shirts printed, and we got those stickers that's on that adorable little boy wearing the From the Wild Things Are Making Mischief shirt that said, got insurance, got milk font, not if you have autism. And anybody who was unfortunate enough to get too close to us got those pasted on them, and we just worked pretty relentlessly. When I was doing my Lend paper, I found this quote from Dr. Robert Jarvik that I put at the end of the paper, and it turned out to be very prescient, which was, leaders are visionaries with a poorly developed sense of fear and no concept of the odds against them. And I think that really characterized a movement. So I call it the fearless and the clueless. And the fearless were the leaders and the legislators who got the law passed. The clueless were Terri and me and the band of parents who thought we were actually going to get this law changed, but we did. So now I will show you a video, which...
Some insurance companies are not happy, but the parents of autistic children were cheering at Fenway Park today. They called it more exciting than a playoff series. The governor signed a bill forcing insurers to offer a full range of coverage.
And News Center 5's Pam Cross is live at the ballpark tonight, where advocates are calling this, Pam, landmark legislation.
They do call it landmark because it covers a variety of medical services for a number of ages. They held it here at Fenway because a member of the Red Sox family is an autism advocate, and supporters say the governor and the legislature hit this one right out of the park and over the green monster. They waited a long time for this.
Both my husband and I are school teachers. We work 2 and 3 jobs to pay close to $15,000 a year just for things that our insurance company won't pay for.
They filled a section of Fenway Park to say thanks. The law requires insurance companies to provide coverage for all forms of autism. It affects the 10,000 Massachusetts residents with autism, both children and adults. Advocates believe the state will save money.
Either the families are going bankrupt taking care of their kids, or the kids aren't getting the care, and the payer of last resort is the state.
So this is for Amy and Jack and Elena and Mary Catherine and George.
With their adult autistic son watching, one of the bill's sponsors named the children of those who worked for 2 years to change the rules. They got a salute from the governor.
You are the reasons why, no matter what else was before the legislature, this issue and your needs would not be forgotten.
Someone had said it's a home run, I think the mayor said, but actually to me, it's the bottom of the ninth, and somebody had a grand slam today for autism.
In fact, they're probably looking for some grand slams tonight. Business says that this is a bad idea, that it will push up premiums for everyone. But with the numbers of autistic children growing each year, others say the law is real relief. Reporting live from Fenway Park, I'm Pam.
So that was a great day. It's the only law that was ever signed at Fenway Park. We're quite proud of it. And the law, we love our acronyms. It was called ERICA, which stands for An Act Relative to Insurance Coverage for Autism. But it's a pretty straightforward law, and you can get a copy of it on our website. It requires insurance to cover medically necessary treatment for autism, and it's got 4 main categories of care, it doesn't specifically call out any other care except ABA therapy. And the reason that was in the law was because it was never covered before, whereas sometimes you could get some speech, often very limited, occupational therapy, other things, but ABA was never covered. And if it wasn't in there, it probably still would be covered. But I like to say it was written to be deliberately vague. So this language, including but not limited to ABA, is from the legislation. And that was meant to cover all medically necessary treatment that was medically necessary in 2010 and treatment that wasn't on the horizon that we hope will emerge with research and therapy to be covered. And it covers other therapies, including psychiatric, psychological therapy. But the other thing, and I think Jean alluded to this was the first law that had no age limits, bills limitations, or dollar caps. But that was really the result of our strong leaders who worked in the Senate and the House and with the governor to get that. But person with autism is person with autism, whether you're 2 or 82, and there might be differences. Hopefully there are in the treatment and whatever, but you have access and coverage to the treatment. So I again thought I'd kind of done my bit for the cause, and I was going to go back to pursue that work-life balance. However, before the ink was really dry on that law, we realized the work was just starting. You have a law that is really system changing, and it requires coverage for treatment like ABA and other autism treatments that have never been covered by insurance before. And I don't have to explain to all of you, treatment in a medical model, you have to do certain things like have licensed providers and have CPT codes and have infrastructure, things that we didn't have any of that. And things that might be straightforward in other treatments, like you go for a doctor's visit and there's a copay when you're getting some autism therapies that may happen multiple times a week, a day, just things like copays. How are those going to be handled? So the questions were really, really than we expected. And our group of amazing advocates was continuing to field them, but it became apparent that this was bigger than what we could do out of our little kitchen offices and other car back seats as we're driving to appointments, et cetera. So back at the Shriver Center, where we started all this trouble, they established the Insurance Resource Center in 2011. And for me, I felt like I kind of died and went to heaven. And they had like a copy machine. They had people who could answer the phones, but it gave us the infrastructure and an organization that could really support what was needed by the family. So we were started in 2011. We're here 10, 15 years later with an expanded mission for autism and behavioral health. And we were set up as a resource for the whole community. We provide, we've answered thousands of individual calls and technical assistance. We continue to do that. We've trained tens of thousands of people, and our website has had hundreds of thousands of visits. So we go one more slide. And in layman's terms, everybody has an insurance card. It's got lots of things on there. Rarely does it give you clarity of how do you access any of the kinds of treatments that our families need. And then there's lots of insurance laws and regulations that apply. However, just because it's confusing, 2 people could have the same insurance card and it's subject to different laws. So for families to figure this out and providers and anybody else can be very, very complicated. And we know that, we understand that. We've developed tools, resources, and that's on basic terms what we do. We help the entire community we knew from the beginning we were going to help families and providers and clinicians. What has been really, for me, unintended, although the legislator, Senator L'Italian, who spoke in the video, told me this about a week after our center was stated, is we help the state and we help regulators and legislators because we affectionately refer to ourselves as complaint central. People don't call us when things are going well. But what we do is we take that information and, you know, one family may be struggling with a barrier or a provider may be encountering something. When we hear that, we can aggregate that and we can spot trends and problems and disconnects. And it gives us an ability to work. You know, our first line is we work directly with a lot of the insurance companies, but we can bring things to legislators and regulators and state agencies if there's a disconnect and something that isn't working quite so well. And so we've become a great resource for everybody. So I'm going to turn it over now to Terri, who's going to talk a little more about our specific work. Thank you.
Thanks, Amy. Can you hear me okay? So one other piece I want to add on who we help is that due to our generous funders and our grant funders, we're able to offer all of our services free of charge. And I think that's really important to understand that no matter who contacts us, they're not going to be charged or asked to come up with a credit card. Now, why is that important? Because as Amy said, oftentimes people call us when the wheels have fallen off the bus, right? When something's wrong and they're stressed and they're looking for information and support. And so to be able to offer that, whether we're contacted once or 500 times by the same family, it doesn't cost them anything. You know, we've always said that it's not the people we hear from, it's the people we don't hear from. And so want you to know that, you know, your patients can always contact us. And if it's not within, you know, autism and behavioral health, we do have a lot of contacts and we'll refer them to the right resource. So one area that we've really focused on, and I think this is really statewide, is how do you reach underserved communities? Because as we said, oftentimes the underserved communities are the ones that either don't know about us, need the information and support more than anyone else, or there's a significant language barrier to be able to obtain the information they need. And as we heard from a family once, we didn't realize this, they said, do you know, in our language, we don't have acronyms. The entire medical community is acronyms. That's how it exists. And so to be conversational in English is one thing, but to be able to read something that looks so confusing because of the use of acronyms. And so as we've come to understand so many of the families and communities with cultural and linguistic diversity, we've worked really hard to target in the community the leaders in that community and provide materials that are translated. We have up to 9 languages now. We do a lot of presentations that we can have a breakout in Spanish or Portuguese. We have 2 staff, amazing team members who can speak several languages. So our point is we can reach virtually anyone, and we added a language line. So of course now we have 180 languages that if someone reaches out to us, and one of our first calls it was really interesting. It was a family that needed outreach in Japanese, and our colleague said, well, that was the first time I heard the mother and daughter arguing in Japanese about what her needs were and what weren't and what wasn't. So again, we're really pleased that we're reaching so many individuals that said, I just didn't know what to do. I called Mass Health and I was told no, but not told no if it can change to a yes if you do this. Just the answer ended and they never got to where they needed to be. So we work so hard to get them to where they need to be. Insurance is, as Amy said, very complicated. It should be. You have you're an employee, you have a benefits in your health plan, and you access those benefits. It should be easy, But I think we all know that the medical surgical side of health benefits versus the behavioral and mental health side can be very different. They should be on parity with one another, but oftentimes they aren't, which makes access much more challenging. So what we've broken insurance down into is, if you really look at the three circles, you have the blue circle, which is fully funded. Without going into a lot of details or into the weeds, when a law passes, like the insurance law that passed ERICA in 2010, it impacted employees that had primarily a fully funded plan, the blue circle. Well, what does that mean? It just meant that if you had Blue Cross, you now had access to autism benefits. But most people work for an employee that is in the red circle, which is called self-funded. For example, you work for Raytheon, you work for Walmart, and you're offered a health plan. Well, that's federally regulated. The feds didn't say you had to have ABA, for example. So, well, thinking back to what was in 2011 when the law was enacted, there wasn't a lot of people that could still access the benefits, not that long ago. But what happens when a law passes, and this was so significant, is that oftentimes employers want to be good citizens. So what happens is they start adopting the coverage anyway, whether they have to or not. And what's happened over the course of the last 13 years is now the majority of employers, really almost all of them now, have adopted autism benefits. So that's what happens. It's like a domino effect, right? And so we're in a place now where there is access to benefits. But what happens is, as a clinician, when you make a recommendation or of a treatment to an individual, oftentimes said, ABA, applied behavioral analysis, it's the most prescribed treatment for autism. It can result in some great outcomes, whether it's reducing maladaptive behaviors, improving communication. However, what oftentimes you may not realize is that depending on someone's insurance, that can result in hundreds and hundreds of dollars a month in out-of-pocket costs. And families are dumbfounded because they're just so focused on getting the benefit that you're not looking at the details in your health plan. You just see, oh, we have coverage for ABA, isn't that great? Well, then all of a sudden, 3 months later, we get a phone call because the family has gotten an $1,800 copay bill. So there is this yellow bucket, which is public health plans, right? Mass Health, Medicaid, Medicare. And that's what, in our space, we do a lot, is to help families enroll in supplemental Mass Health. Why? Because that's going to pick up their copays on many of those out-of-pocket costs that they have. So we work really hard to provide what we say is really more robust, comprehensive coverage. Because one of the worst things that happens is someone stops treatment because they can't afford it, right? And that's what we don't want to happen with children, especially for some of the newly diagnosed who are receiving much more comprehensive services, right, before school. So Mass Health, again, in Massachusetts, we call it Mass Health. It's Medicaid, and it's an income-based system. But if you have a loved one with a disability, whether they're 3 or 43, they can have access to Medicaid or Mass Health via their disability. Think of it as a side door entrance, right? Mass Health, it's front door, income only. If you don't qualify for income, you're kicked out, but you can come in through disability. So what does that mean? Well, it means income may still be used to calculate a premium. And that's the reason that we're sharing this. Is the other thing that we hear from families, from their well-intentioned doctors will say, go get Mass Health, which is good advice. But they don't tell families that it's not free. The family is agreeing to purchase health insurance from the state. There's ways to help reduce the cost and make it affordable. But again, it's really, it's really important that that families understand that there's that Mass Health isn't free, okay? For many families over income. So families will call us and say, my child has autism. Mass Health is going to cover everything. So I'm going to drop my child off of private insurance. I don't want them on my employer plan. Well, they can't do that. All right. Private insurance has to remain primary employer insurance. Mass Health can only be secondary. And again, sometimes we hear from families who are told, well, you know, we were told by the provider, just drop your employer insurance, you know, drop them off and only use Mass Health. You're not allowed to do that. It's against insurance regulations. ABA, does a child have to have an autism diagnosis to be able to access applied behavioral analysis? Right now, it's yes. That could be changing in the future. There's a couple states that have expanded ABA outside of autism, just to IDDD. We get a lot of questions from the Down syndrome community about access to ABA. And as of right now, you do have to have an autism diagnosis, but it could be changing across the country and in Massachusetts as well. But for right now, it has not. If a child has Mass Health, we already talked about that. They can't drop their employer insurance. Mass Health is payer last resort. And does Mass Health coverage expire? Well, it doesn't, but because it's an income-based system, Mass Health asks for annual renewal. They want to know, has your income changed? Has it gone up? Has it gone down? Because again, if they're calculating a premium, they want to make sure that someone's income is accurate. And the other issue that we see very, very frequently is families just ignore the request. And they call us after the provider says, do you know you don't have insurance anymore? You know, we've been treating your child for 2 months and they don't even have that coverage anymore. They come to us with coverage terminated. So we can help, but it's usually because they've ignored the requests to renew their Mass Health. Again, I'm going in the weeds a little bit here, but I think what we're trying to get at is this gets really confusing for families, right? They're focused on, I'm just trying to keep my kid in school. I'm just trying to get after school service. And I'm dealing with all of this with my insurance and I'm not sure what to do. Well, you do now. You can send them to us because that's why we're here, because we help unravel some of the issues going on. And we want you to know that this really valuable service is based here in the medical school, and it's available throughout for anyone throughout the state of Massachusetts. Okay. Amy?
I would also note that a very, very common phone call is, my doctor told me I should get additional Mass Health coverage, and I called and I tried to enroll. They said, oh, you make too much money, you have employer insurance, you can't get that. Or they get through the basic application process, but for these people, they need to have a verified disability. So they get a kind of Mass Health that doesn't really cover anything. And then they sometimes call us after they've gotten that Mass Health, they get a bill, it's not covering anything, so they cancel it. And it requires putting, 3 or 4 pieces together, and it's just not very well understood. There's always sort of the flavor of the week, and what we're seeing now is during the public health emergency, Mass Health relaxed a lot of things, and people stayed on the rolls. They didn't do the redeterminations. Now that they're starting them up again, there are families who got Mass Health 2 or 3 years ago during COVID were not charged copays. Now they're going through redetermination and suddenly finding they have a copay, so they have questions about that. And then sometimes in the redetermination, it hasn't been super much, but we've had a few train wrecks where family did everything right, but when they sent their W-2 to Mass Health, it got input as weekly income instead of annual income, so they got this outrageous bill. And They tried to, I think it was $12,000 a month. They tried to resolve it on their own. They called Mass Health. They got, transferred to 4 people. Mass Health customer service deals with huge volume of calls. People in this group are very small. So finally, the 4th person they got to said, well, I guess that's your bill. You're going to have to figure out how to pay it. And so when they got to us, thank goodness, and like we said, there's probably a lot of people we don't hear from, but they got to us, and our team, who include Mass Health certified application counselors and can go in and look at the systems, could see the problem, adjust it, and it was like $140 a month. And we talked mom off the ledge, and we do work closely with Mass Health, so we can reach out to contacts there and say, yeah, this might be a training opportunity for some people. And I come up from the banking system, like there should be a circuit breaker, like somebody looks at this. And just yesterday we got a call where a 4-year-old, I think, that they put in the income both for dad and the same income for the 4-year-old, each member. So their bill was very high, and it looked like their 4-year-old has a quite successful job with
Their 4-year-old had a 6-figure income.
6.
We'll just say that.
So, something's probably not right there. And that's the kind of stuff we do, day in, day out. But to a family where this is a barrier to treatment, it's huge. So how does this affect education plans? This was something that Terri and I were really focused on, because as parents of children who could only get services through school when they were younger, and sometimes you could only get those through a lot of advocacy, and you had to live in the right district, we didn't want anything we passed on an insurance level to affect those. So what we learned is that the law for education services is a federal law. It's called IDEA. So anything we passed on a state level, think back to those 3 buckets, was not going to affect IDEA. So under this IDEA, law schools provide, we love our acronyms, free and appropriate public education, FAPE. What was FAPE in 2004 is FAPE in 2024. And so it couldn't change. And then there was language put in the law, that's ERICA, that's the Mass General Laws, whatever, to specifically say that nothing in ERICA was going to change the school's obligation, and then the request of the insurers, schools can't then bill insurance companies. And then the Department of Elementary Secondary Education, which has kind of been a partner of ours and a funder of ours, wrote a bulletin that described this in more detail, and explained to schools that they can't change what they provide to students. They can't require families to seek it through insurance. So the education medical has always been a question, and the 2 circles might intersect, but if there's a service like ABA after school that might be required, needed under FAPE, and also could be medically necessary, it's a family's decision which way they want to use to pursue it. So it's not, we could end there, it'd be a great story, but we're in a tough place right now. And we were in a tough place before COVID. So what's happened, not dissimilar with other healthcare, this was new coverage for treatment. It attracted and continues to attract a lot of investment. It has attracted a lot of people to the field. So I show this graph to show the rise in the number of certified behavior analysts in, say, the last 14 years. And you can see this graph has gone up steeply. And why is that a concern? It's good that we have more people, but I'm getting a lot of these people are really young. They're not necessarily super experienced, and they get put into situations and things where they need a lot more training and they need background, and they're given cases and handling things that aren't always going so well. So it's a relatively young workforce. There's probably not, just very generally saying, adequate supervision, and they may not have adequate training to work with some of the individuals with autism who have more challenging behaviors. There has similarly been rapid investment. The private equity space, they calls this a great space because there is so much growth. So they have invested a lot of money and a lot of growth with expectations of returns that may not be realistic. And in terms of how private equity works, which could be a whole separate thing, a structure and a financing structure where they get a lot of the monies off of the top, and there may not actually be, at the end of the day, after the reimbursement, adequate funding for the actual therapy and the therapists. This shows the growth just in Medicaid Mass Health funding. Mass Health began covering ABA in 2015. So this is both for primary and for copays.
And one thing I would add, this is only birth through age 21. Right? This isn't any adult coverage. ABA is only through age 21. So,
but I look at the graph we have of the behavior analysts is a national graph. We don't have one for Massachusetts. It's pretty similar curve, but I look at the growth in the expenditures. I look at how many of these young BCBAs you have or licensed behavioralists who can cover it. There's not enough people to adequately supervise just that 185 million plus whatever private insurance, which is definitely probably more than that, is covering on top of it, or at least equal. So there's a lot of concerns. And I mentioned that we work closely with state agencies, and we, have been contacted by people from the Attorney General's office who are like, can you explain ABA to us? And we're seeing they get referrals, they're looking at things. There are concerning trends about that. And I kind of liken the industry and the space and the field to an adolescent. It's grown really, really fast. It's still really, really young. We have inconsistent quality, huge turnover, I don't have to tell you that. And then these aggressive or unrealistic investor expectations. And so what happens to adolescents and teens? They get into train wrecks. And so that was the only picture I could find that was like public stock, but unfortunately, we do see those train wrecks. And, it's really helpful that Terri and I have the business backgrounds that we do, because it gives us some ability to maybe look at that, analyze that, try to address that. But it's a tough space, and it's damaging the field. I don't have to tell you, I wish we weren't on Zoom. There's probably a lot of clinicians, and you may be shaking your heads that you are probably hearing from your patients, either they can't access ABA, or what they're accessing is not quality ABA. Or if they're accessing and it's quality, there's so much turnover and disruption that it's really, really hard. And so we're hoping that it gets better. I think there will be maturation. The investors are figuring out that this may not be, so we're seeing a little bit of pulling back in terms of what they're investing in and how aggressively they're going after it, which ultimately I think will be a good thing. But there's definitely, we're at a phase where it's very challenging. There's going to be a little bit of shakeout. So do you want to talk about the last part? We're going to both talk about it, but these are some of the issues we see that families face. And I'm going to turn this off.
So as we all know that the diagnosis of autism, I mean, it keeps exploding. And so the numbers are, now they're saying by age 8, 1 in 8 boys has an autism diagnosis, which is just unbelievable in the United States. So, but what does that mean? Well, how do you get a diagnosis? Or how do you, if there's a suspected diagnosis, the waits for just obtaining a diagnosis. Once you have a diagnosis, now you have to wait oftentimes for that medically necessary treatment to be able to access that. So, and as Amy said, then when you do obtain services, sometimes people are so desperate, they'll take something that isn't the quality that they need. And the other thing too with families that we hear is oftentimes they're told, get ABA, get ABA. They don't really even know what it is. They really don't understand. And so we have some materials to help families, and there's one that we share on our website, which it was written by a parent who's also a BCBA, and she just very simple. Here's the 10 questions you want to ask a new provider to obtain quality ABA. And this is like so wonderful for parents because they don't know where to go. They don't know what to ask. And particularly for English as second language families, we have it in Spanish, we have it in Portuguese, so that it fosters an understanding of what they should ask for so that they can try to obtain the highest quality ABA. And again, the high turnover of staff, I mean, we're in a we're in a workforce shortage everywhere, right? It's not just this industry, but there's, it causes a lot of disruption where someone doesn't show up and the family's afraid to cancel and go to another ABA provider because, you know, they might be just putting themselves in that same position once again. Providers are also facing a lot of issues. You know, we just talked about staff shortages. You know, the registered behavior techs that are the ones that are going into the house that are often doing some of the, you know, initial work with the individuals. As Amy said, they're not, oftentimes they're not well trained. They're well-meaning and well-intentioned, but oftentimes don't have the best training. If they don't have that supervision because there's staff turnover, again, it can cause some real issues. There's also some barriers on occasion with getting credentialed, and that's causing a backlog because they have these wait lists and they're saying, look, we're trying to reduce the wait lists, but we can't get the carriers to get these folks credentialed quickly so that we can begin submitting for authorizations. So it's somewhat of a cycle that continues. Lack of business expertise, and I think this is true in the healthcare industry in general, that you're in the business to provide help for people because you care about people, but oftentimes, you know, with BCBAs, they start a business, but they don't really know how to run a business. And what we see sometimes is they'll hire a billing entity from outside of the state and they don't know how to submit claims. Well, that can be a problem when there's an audit and the insurer's like, what's going on here? What are you billing us for? So it again could be a negative cycle on the compliance. And you know, the other thing with these small, inexperienced agencies, they don't have compliance officers, they don't have the back office systems, they don't have experience with insurance. And then sometimes there's, you know, family demands, expectations, dynamics that can be challenging to deal with. So again, go back to that graph, a young BCBA, a young staff facing all these challenges, and it can be tough. I'm gonna just go to the next slide, but it looks like there's some questions in the chat and I'm gonna see if I can.
I ask them?
Yeah, sure. Oh, sure. So for the first, till about 2020, we were the Autism Insurance Resource Center, focusing on first the private insurance and for autism and then Medicaid, Mass Health. We, as Terry was explaining with the Mass Health Secondary, that's for people with all disabilities. And we were getting calls and everyone was like, oh, I'm so sorry to bother you. Could you just do me a favor? I don't have autism. I'm so sorry I have Down syndrome, but I could really use your help. So we would help anybody, but it was hard. And then parallel to the increase in autism services, the state has been rolling out a lot of behavioral services. So there's something called the Children's Behavioral Health Initiative that was rolled out in 2010 and has continued to expand. And then later in the 2000s, there were regulations to require private insurance to cover similar things. So in 1920, the state came to us and they said, we'd like you to do for behavioral health what you have done for autism. And so we expanded our center. You know, if you haven't figured out, I'm pretty invested. So I had to get rid of the Autism Insurance Resource Center name, and we expanded to the Insurance Resource Center for Autism and Behavioral Health after the first flyer came out. The Autism Insurance Resource Center will help you even if you don't have autism. And I was like, hey, we need to grow up here. So I would add too is, you know, with COVID, that exacerbated mental and behavioral health issues. I mean, they just bubbled all over. And so the timing just was perfect that the state had an entity that people could find that support that they had through autism. So we expanded to cover behavioral health and we got funding
generous funding from the state to do that, which was phenomenal. And what we did with that was, in addition to expanding our team and bringing on the additional team members for the volume, we expanded our functionality and we brought on people. Our insurance navigation manager came from the Health Connector and just has a complete overview and understanding of all the systems and people. And she's a person who has like more friends, best friends than any of us even know. So what she's been able to resolve a lot of things and make a lot of connections for us. And then we have 2 certified application counselors. So we expanded depth, breadth, and it's really made us much more effective.
Okay. Question online. Do you also provide support to autistic adults managing their own care or just the families of autistic children?
We provide support to autistic adults, yes. And, you know, we are seeing and getting more and more inquiries from adults with autism and behavioral health needs, as well as families supporting aging adults who are getting into, you know, issues of elderly that affect elderly people with healthcare, and then elderly people plus autism. And sometimes too, it might be the autistic adult who's, I hate to use the terms higher functioning, but relatively independent and managing this. Sometimes it's a sibling of an adult who has found themselves now as the caregiver and doesn't have the decades of experience that their parents had who were helping through those issues.
I mean, another example we have was, this happened probably a year ago. We got a call from a sibling and she said, my sister is 73 and has lived in my parents' house her whole life, but she needs nursing care. Is it possible to get a BCBA or behavioral consult to make her nursing room more sensory friendly? So that's just a typical, you know, that it's such a wide depth and breadth that when we say it's across the lifespan, it really is.
So another question is, can you share the 10 questions to ask about ABA with us? Also, do you have a list or compendium of resources for adults with autism spectrum disorder looking for therapeutic resources?
So the 10 questions list, what I would suggest is that you contact our center, and I'm looking at the last slide here, and we don't have our contact information, but if you go to MASSAIRC.org, you can get a contact us, and we'd be happy to get that out to you. Or if you want to contact the organizers of the Grand Rounds, we can get that to people. And what was the second question?
Do you have a
resources for
resources
for adults? So we probably, you know, we are focused on insurance and insurance related issues. And some of the questions for adults, if they're broader, we often refer them to an organization called the Autism Asperger's Network, AANE. And they've changed their names a few times. The initials is AANE. They're very well known. They have great resources and work a lot with adults. But you can certainly start with us, and depending on what the issue is, we're happy to try to help.
And what can be very helpful with AANE is we do hear from adults who feel they are autistic but have never been diagnosed. And AANE is a resource even for those who are undiagnosed. They will provide services on a fee for pay service.
Okay.
A very common inquiry is, you know, where can I find a place where I can go for diagnosis?
So Lauren Venuti put it in the chat, AANE.org, and also MassAIRC.org.
MassAIRC is our center.
Okay.
And Lauren, thank you for doing that. Could you also type in our phone number, 774-455-4056? And then our email is airc@umassmed.edu. You know, COVID, I don't think we have to even explain, has been a huge impact and is continuing to impact things. Telehealth was only somewhat helpful for this population. And then we've seen a huge increase in severe behaviors, a serious backlog for young children needing diagnostic services as well as services, and then the continued workforce issues. And then we'll take more questions if we have time, but this is Terry and my contact information. A big thank you to the funders who have been with us since the beginning and grown and expanded and been very generous about providing increased funding as we have expanded our work. And really to Jean and the Shriver Center for our support, because when we started, you know, I was a center of 1 and then 1.5 with Terri.
I had volunteered, I thought, at first.
She wanted to volunteer. And, you know, we create a little bit of a wake, and they've really been just given us a home to do this work and make this impact that we are grateful for every day. So,
Well, thank you. It doesn't look like there are any more questions. So thank you very, very much. Very interesting.